something that's been in the spotlight for a long time and continues to be, and that is Alzheimer's and other forms of dementia that are sweeping the nation, also worldwide. Alzheimer's is a devastating disease with an impact on society that almost can't even be calculated. So today I want to cover what is Alzheimer's, what are the symptoms you need to look out for, some of the things I think the causes are, and some of the things you can do that aren't really being talked about right now. We've been studying this for over 20 years and the effects of brain activity and what people can do naturally to prevent, reverse some of these symptoms and reactivate their body's self-healing mechanism. Alzheimer's is a degenerative brain disease. It affects the brain and it also affects how you think. It's actually the most common cause of dementia among adults, and currently it affects over 44 million people worldwide. That is a lot of people. There's really no gender-based predisposition for Alzheimer's, but about 2/3 of Americans with the disease are women. So it really affects the majority of women, actually. So last year, close to 1 million people in the United States died from Alzheimer's. And the outlook is not improving. It's actually getting worse. By 2025, it's projected that the number of people with Alzheimer's over the age of 65 will increase by 40%. Those are numbers that have been put out by the associations and the medical journals and things like that. I personally see a rise, and I'm projecting numbers closer to 60%. Another thing, even though it's often thought of as a disease that only affects the elderly, now there's something called early onset Alzheimer's, which can surface in a person's 30s or 40s. And this affects about 5% of Americans right now, but we're also seeing a steady increase in that as well. Now, Alzheimer's happens as a result of changes that take place in the brain. Nerve cells get tangled up, and that's what's called neurofibrillary tangles. But there's also protein deposits that end up being deposited in the brain, and those are called beta amyloid plaques. Beta amyloid plaques. And those end up building up in the brain. And these are two things that scientists have noticed that they're relating Alzheimer's and dementia to. Both of them are the standard hallmark signs of the medical profession. But it's really hard to diagnose Alzheimer's because it can be real tricky. It involves different physical tests, different mental tests. One of the tests is called a positive emission tomography scan, or a PET scan. It's a type of imaging test that uses a radioactive substance, which personally I don't like, any type of contrast material that you have to drink or that is put into the body somehow before a scan. All of them are toxic. They're all dangerous. They can cause severe allergic reactions. It's a tracer is what they use it for. And what it does is it goes in, you take this radioactive substance, you do the PET scan, and it highlights the amyloid in the brain. But these scans are also pretty expensive. Now they're starting to come out with some blood tests. That's kind of the future of what we're looking at for Alzheimer's diagnosis. And the most common symptoms include memory loss, forgetfulness, difficulty with everyday tasks, communication problems, disorientation, poor judgment, thinking problems, just a basket full of different mental disorders or mental effects or mental problems that people are suffering from. And when you think about how these mental effects play out in real life, you realize what a horrible situation it can be. I mean, start losing your mind. To me, that's got to be one of the most devastating things that can happen is forgetting who my wife is or forgetting who my kids are. Elderlies, anyone with dementia, Alzheimer's, they turn the stove on and forget to turn it off. Fires start that way. These are real problems that we're dealing with in society, and people's family as well have to deal with it. And it really affects the family. Basically, Alzheimer's is a disease that may and eventually does require around-the-clock, 24-hour-a-day care. And that really opens up another can of worms right there, because Alzheimer's is bad enough to deal with in its own right, but when you consider the financial burden that comes with this disease, it goes to a whole nother level. The fact is, Alzheimer's is one of the costliest chronic diseases to society and to families. Now, I touched on this a little, but one of the less discussed costs of Alzheimer's, and it can't be ignored, is the immense toll it takes on family and caregivers. Over 15 million Americans are unpaid caregivers for someone with Alzheimer's or dementia, and most of the time it falls on family members. As a matter of fact, the Alzheimer's Association reports that about 80% of at-home care is provided by a family member. In 2014, friends and family provided nearly 18 billion hours of unpaid care. And 2/3 of the caregivers out there are women, and 34% of them are over the age of 65. That is just a struggle that's flat out heartbreaking. And these people are usually not doing it with vast resources. 40% of the caregivers out there have a household income of $50,000 or less. It's so good that we have so many nice, caring people out there. And it's no surprise that 60% of Alzheimer's and dementia caregivers rate their emotional stress levels as high or very high. And 60% of Alzheimer's caregivers, out of all those, 40% of them suffer from depression. So not only are you having the Alzheimer's, but you're having the problems with the caregivers, which are having extreme stress levels, and 40% of them suffer from depression. Alzheimer's, it isn't a part of normal aging. So if any medical or any doctor tells you it's just normal that you're going to get it, they're wrong. But aging is the biggest risk factor, because if your body accumulates chemicals and toxins for years and years and years, that's definitely going to take a toll on your body. And every 5 years that you age, your risk actually goes up for some form of dementia or brain dysfunction. So what is the standard medical philosophy? What do the allopathic doctors teach us? What does the American Medical Association, the Alzheimer's Association try to preach to us? Is that it's generally believed that the disease is a combination of age, genetics, environment, lifestyle, and other medical conditions. Honestly, I don't even think they know what it is. I can tell you this. One conclusion that I've come to after looking at all the research that's out there is that the cause is exposure to toxins, environmental pollutants, a clogged liver, a malfunctioning liver, and too many chemicals and heavy metals, pesticides and herbicides, and too many chemicals and toxins in the food, the air, and the water that people are taking into their body on a daily basis. And actually, studies have confirmed that. Recent studies that toxins and environmental pollutants are associated with Alzheimer's. One of them is pesticides and herbicides, which I mentioned. There was a study by the American Medical Association's Journal of Neurology that found Alzheimer's patients had 4 times the DDT metabolites in their blood as people who do not have Alzheimer's. DDT was a toxic pesticide used for years and years and years. It's banned now, but it was used from, I think, the 1930s all the way up to the 1970s or something like that. And we know for a fact that Alzheimer's patients have 4 times the DDT levels. The next one is glyphosate. If you have bottles of Roundup from Monsanto, that is the company who is destroying our food supply and also destroying most of the agriculture and the soil. Roundup, the main ingredient in that is called glyphosate. It's a strong pesticide that's taken over the world. It's contaminated a huge portion of the food supply, especially the genetically modified foods. And it's actually worse than DDT. You can't even wash it off. And everybody's spraying it in their gardens around their house, and it's on any type of non-organic foods. The deteriorating effect they have on brain health is just one of the many problems associated with pesticides. And we've got tons of information about that on globalhealingcenter.com. If you want to go to the website and just type in glyphosate, pesticides, herbicides, effect on the body. I mean, we have plenty of information on that with the clinical research. I always want to provide people with the actual studies so they don't think that I'm just up here sitting here talking about stuff that's not proven. One of the things that's kind of weird that you might not think of is Alzheimer's is correlated with a deficiency in the supply of fat and cholesterol in the brain. Now, this is something that I've spent a lot of time researching, and I know that it's one of the main causes of Alzheimer's that I think, and that's the lack of cholesterol that's getting up to the brain. And that's been proven in many clinical trials as well, and actually clinical studies, as there is a deficiency in the supply of cholesterol in the brain and the way the insulin in the brain works as well. Now, that sounds odd because a lot of people have heard cholesterol is bad, but that's a gross oversimplification. The reality is that cholesterol is critical for nervous system function and brain health. It actually protects the nerves and helps facilitate communication between the cells. So people with Alzheimer's have been found to have significantly less cholesterol and fatty acids in their cerebrospinal fluid compared to individuals without Alzheimer's. How does that work? That comes back to linking to the liver function. The liver is what produces your good and bad cholesterol, LDL and HDL. Keep your high HDLs high and keep your LDLs low. That's the general scheme of things. Your low-density lipoproteins are your LDLs, and your high-density proteins are your lipoproteins are your HDLs. Columbia researchers found that people with a solid balance of good cholesterol were 60% less likely to develop Alzheimer's. Now, a cholesterol imbalance might be dietary. In fact, a healthy organic diet with the good fats has been found to improve cognitive abilities and some of the other symptoms associated with Alzheimer's. Good fats are going to be your cold-pressed virgin organic olive oil, coconut oil, avocado oil, which is really good to use, especially during cooking because it can go up to 400 and something degrees without disabling it or breaking it down. Those are going to be your good fats, adding good fats into your diet. But one thing that surfaced recently is statin drugs, which a lot of people are on for high cholesterol. Could be causing problems and contributing to Alzheimer's. One thing you don't want to do is you don't want to mess with your cholesterol production in your liver. Think of how many people right now are being put on dangerous statin drugs. That will completely block the good cholesterol that you need in your brain and throughout your body, by the way. The good cholesterol is distributed everywhere in your body. It's vital for all of your systems to work, and it's vital for all your systems to function. It protects your cells. So putting someone on statin drugs is like lighting a fire. It's just, extremely damaging to the body. Statin drugs inhibit the enzymes and interfere with the synthesis of both cholesterol and coenzyme Q10. And that, like with a lot of the prescriptions, can have serious, serious unintended side effects. Now, the next thing I want to talk about, which is associated with Alzheimer's, is aluminum. You might have heard that aluminum is associated with that, and in fact, that's probably the toxin that you hear about the most. There's no question about it. Aluminum, when it gets into your body, is a neurotoxin. It's been proven to be a neurotoxin, and it actually causes brain inflammation. So what you want to do is avoid aluminum-based deodorants. Most of the deodorants have aluminum in them. You don't want to drink anything out of aluminum cans, beer, soft drinks, whatever. You don't want to use any aluminum cookware. And there's, alternatives. There's natural deodorants right now, aluminum-free. You can use ozonated olive oil as a deodorant. You want to use ceramic, Teflon-free, non-toxic cookware. And then if you're going to be drinking anything, make sure you're drinking out of glass bottles. Another big problem that's been associated with Alzheimer's is mercury. Mercury is extremely toxic to the brain. It affects both short and long-term memory, reason, attention span, and it's linked to the formation of the neurofibrillary tangles that we were talking about before that you're seeing on the PET scan. Mercury is directly linked to that. Some research has actually found that people with Alzheimer's have 3 times as much mercury in their blood than people without. How do you get mercury in your body? A lot of tap water. I know a lot of tap water is not only mercury, but arsenic, lead, cadmium, nickel, all kinds of aluminum. What you want to do is just avoid any type of tap water if you can. Mercury amalgams in your teeth. Find a natural dentist, find a holistic dentist who can safely remove the mercury from your mouth. That is one of the most important things you can do. And next, one of the things that we've really been studying over the last 15, 20 years, it's one of my top toxins that affects the brain, are artificial ingredients, specifically artificial sweeteners. That's going to be your NutraSweet, your sucralose, your aspartame, all of those. Also preservatives that are added to food, colors, flavors, all of those things are neurotoxins. Dr. Russell Blaylock, if you want to look at excitotoxins, neurotoxins in the brain, these are some of the things that you want to research that have been proven over the years. We know for a fact that MSG, for example, has an accelerating effect on the beta amyloid protein deposits. And that's another thing we were talking about that's associated with Alzheimer's. And we know that MSG speeds up the development of Alzheimer's. MSG is hidden under multiple names on ingredient labels. It's basically like, again, pouring gas on the fire. Aspartame, an artificial sweetener that's part of the diet soda craze. In the body, aspartame actually turns into formaldehyde, which is a methanol metabolite. And listen to this, in animal studies, mice that were given methanol developed Alzheimer's symptoms. You should just ask yourself, is it worth my brain literally to eat food that contains this stuff or drink drinks that contain it? For me, the clear answer is absolutely not. Absolutely not. The best option is to live a clean, healthy lifestyle that's not full of increased risks. Another reason you should maintain a healthy diet and get some form of exercise is to support your cardiovascular health. Cardiovascular problems, especially heart problems, stuff like high blood pressure, cholesterol, diabetes, they all raise the risk of getting Alzheimer's. Another problem you might run the risk of having in your diet is poor imbalanced blood sugar. That is also associated with a toxic liver and can also be an aggravating factor for Alzheimer's. The enzymes that lower your blood sugar also reduce amyloid, the amyloid plaque. So when those enzymes are dealing with elevated sugar, they can't reduce the amyloid. So you see how that's all kind of working together. Wellness, health, encourages wellness and health. Sickness encourages sickness. So, even if you're taking one step a day to improve your health, you're still making progress, you're not standing still, and you're not going down the stairs towards disease. And I say it all the time, if you can be well, and everyone can, without prescription drugs, you're going to be much better off. So a lot of times prescription drugs are like a whack-a-mole. A doctor spends 7 minutes with you. How are they going to properly diagnose what's really going on with you in those 7 minutes? They don't ask you about what you're consuming in your diet. They don't ask you about what you're drinking. They don't ask you about your job, if you're around a bunch of metals or toxins at your workplace. They don't ask you about your home. They don't ask you about your stress levels. All of those things are what the real problems are when you look at disease. Drugs just take care of one problem. You might, come in and get put on a prescription medication, and it might take care of that problem, but then 5 others are going to pop up. And then they're going to put you on drugs for some of those other things. Now, I'm not saying you don't need prescription medication every now and then, but you should never be on prescription medication long term. Another problem that's associated with Alzheimer's is hormone replacement therapy, for example. There was at least one trial that found taking estrogen increased the risk of developing dementia and Alzheimer's later in life. Right now, we have so many things that are estrogen mimickers, endocrine disrupting chemicals. We have high levels of estrogen being tested in men and female. We have low levels of testosterone, growth hormone, progesterone. So high estrogen levels have also been linked as a factor to developing Alzheimer's. There's so many people on Adderall, so many people drinking coffee excessively, so many people having problems sleeping at night right now due to high stress levels, due to anxiety. Sleeping pills are becoming increased risk of many different things, but basically all medication is something to be careful with. But sleeping pills specifically have been shown to increase the risk of Alzheimer's. Now, don't stop taking your medications without talking to your doctor and developing a plan. I'm just saying, if you can take steps to be in charge of your own wellness, you're going to be a lot better off. Another thing to consider here, as long as we're talking about brain health, is the mental health aspect of it, specifically stress. I talk a lot about the negative effects of stress all the time, why it's important to eliminate the cause of stress. I mean, it's not good to just take a product or take a medication, because you got to figure out why are you stressed to begin with? The best you can anyway, and find effective ways to deal with that. It's the root cause. So what is Alzheimer's? It's an inflammatory disease. Studies have linked psychological stress to the onset of dementia. So if your body is chronically inflamed, you're going to have a big problem, and Alzheimer's could be one of them. As a matter of fact, every single disease out there, well, I would say the majority of them, probably 90%, has something to do with inflammation in the body. First and foremost, you want to try to eliminate all the chemicals, toxins that you're exposed to on a daily basis. Now that means trying to eliminate these from food, water, beverages, and clean up the air quality in your home. Have a healthy organic diet. My book, The Green Body Cleanse, explains easy ways to eliminate and replace. So it's not like, okay, you need to eliminate all the things you love. That's really hard for people to do. I'm not saying eliminate your, white sugar, let's say. What I'm saying is replace it with a natural, healthier option like organic stevia or agave nectar or coconut nectar, or replace your white flour, which is toxic, with a certified organic, gluten-free type of flour. I mean, the thing is, what you're trying to do is balance everything out. You know, you look at what you're eating, and instead of eating the toxic things, first of all, you want to eat organic things. So all you're doing is eliminating the toxins coming in. And then exercise is absolutely critical. Pick out what you love to do. You know, at least try to exercise a few times a week. Pretty much everyone is in agreement on this. Even the National Institute of Health, the Alzheimer's Association, they all recommend healthy eating and exercise. That also means limiting your sugar. Your high fructose corn syrup should be eliminated. The white sugar should be eliminated. Saturated fats should be eliminated. Focus on organic fruits, vegetables, nuts, seeds. No genetically modified foods. Don't smoke. Stimulate your mind. Exercise your body. It's really all about solid fundamentals. There are a lot of influencing factors, and the more of them that you have in check, the better off you're going to be. And with that, you can't underestimate the importance of mental stimulation. That means keeping your mind sharp. There's a lot of evidence out there that shows staying mentally active supports brain health. That's actually straight from the Mayo Clinic, that exercising the mind boosts your thinking skills, which is it's really successful for anybody that has dementia or Alzheimer's or anything like that, to exercise their mind. Reading, writing, doing word puzzles, whatever you want to do that makes you feel like you're stimulating your mind. When it comes to your brain, it's really a use it or lose it proposition. You know, if you don't keep your brain active, you're just going to lose it. So beyond having a diet that's in order and regular exercise, a lot of people want to know, what are the little tips and tricks? What are the natural remedies and supplements for promoting brain health? And yes, there are a few. Some of the ones that I've used and worked the best are cinnamon. Cinnamon extract is one possible option. There was actually a study published in the Journal of Alzheimer's Disease that found compounds in cinnamon extract that helped stop the protein dysfunction, which could prevent and possibly reverse the neurofibrillary tangles. Now, this may happen because cinnamon supports normal brain insulin activity. So very important. Insulin and insulin receptors in the brain are essential for memory and cognitive functions. Most every person with Alzheimer's usually has an imbalance with their insulin. That's also a reason why the gallbladder, the pancreas, the liver are so important to be healthy. Second tip I can give is ginseng. Ginseng is another one that we've used that really helps support brain health and function. Next is omega-3 fatty acids. This is one of the biggest things. There was information released from the National Institute of Health, an animal study that found regular consumption of omega-3 fatty acids reduced cognitive impairment. Also, omega-3s are good fighters of inflammation, so I would highly recommend getting on a good omega-3 fatty acid product. So is coconut oil, one of my favorites. This is something that no matter who contacts us with Alzheimer's, dementia, no matter what, always, I would highly recommend typing in coconut oil and Alzheimer's in Google. You're going to see videos out there of how successful this actually is. And the reason why is because coconut oil contains ketones. Ketones are a powerful brain food, and people with Alzheimer's don't have those. And definitely think about adding coconut oil to your diet. It's one of the most successful remedies. And I highly recommend you also do some research online regarding coconut oil. Chlorella is another supplement I like. It's similar to cilantro in that it's really powerful for detoxifying and pulling out toxic metals from your body, especially mercury. we actually have a product called Zeotrex, which contains a lot of different compounds which help support the body's natural elimination of harmful metals and toxins. Iodine. Iodine I've talked about a million times. Check out my other video on everything you need to know about iodine. But in a nutshell, it's super powerful for helping detoxify some of the worst mental and thyroid toxins. It's really good. It goes up into the brain, helps detoxify, helps repair every cell in your body. It has iodine receptors. It's extremely important in my opinion. Next is a healthy bowel. Right now, you're seeing I've been saying this for 20 years. There's a gut-brain connection. Everything, if you have a healthy gut, you have a healthy brain. Now, I don't know if there's just more money being put into it. Pharmaceutical companies are starting to say this. They're starting to come out with their own probiotic formulas. There is definitely a gut-brain connection. My next tip is heal your gut, heal your brain. And that means use a good oxygen-based intestinal cleanser like Oxy Powder. Cleanse out all that garbage in your gut. Use a solid probiotic supplement, which is instrumental when it comes to cultivating a healthy biosphere inside your gut, a biome, which is really keeping your gut clean, eating good, clean foods, and taking a good probiotic because you're cultivating a healthy gut. Most of the neurotransmitters, believe it or not, are made, your dopamine, your serotonin, produced in your gut. So you really have to focus on healing your gut. And that means cleansing your gut and taking a good probiotic formula like Floratrex. NADH. NADH, one study found that NADH is just the name of the supplement. And you can find that online anywhere, get a good one. One study found that 6 months of supplementation of NADH positively influenced verbal and mental sharpness. Next tip on my list is just drink lots of clean water. Water is so powerful. And what we've noticed with Alzheimer's, with every disease, is that most people are deficient. They're dehydrated. Every living substance on the planet is composed of at least 80% water. Water is vital to your health. Stop drinking all the dehydrating substances like alcohol, milk, processed milk, not raw milk, energy drinks, soft drinks, juices, which are just full of all kinds of chemicals, except natural juices. I mean, if they're freshly pressed or freshly juiced, those are great. I'm talking about the juices in the convenience stores and the juices in the supermarkets, which are flavored and have all kinds of preservatives and toxins in them. Just look, the only thing the body needs and wants after breastfeeding is water. If you're suffering from any condition, any symptom, most likely it's associated with your liver. Your liver is your detoxification organ. Your liver is the vital organ in your body that needs to stay clean. So the success that we've seen over the years comes with at least 3 liver and gallbladder cleanses. And that's with the olive oil. You have to take the olive oil because the olive oil works like oil pulling. It goes into the liver and it literally pulls out all those chemicals and toxins and everything. So I would say if there's one thing I would recommend, the number one thing I would recommend is liver cleansing for everything, actually. I mean, we're just living in a world right now where we're exposed to so many chemicals and toxins coming in that in our research, we found that the majority of the people, over 70% of the people over the age of 40, their livers are only functioning 40%. And your liver needs to be functioning 80% for you to be healthy. So do your best to follow a healthy diet, eat as much raw food as you possibly can. And not only that, cleanse your intestines and repair your gut. Cleanse your liver and gallbladder. Cleanse all the chemicals and heavy metals out of your body. It's all about cleansing. That's what I have to give you. That's the research that I've come up with. I wanted to share with you regarding Alzheimer's, dementia. You can always go to our Facebook page. You can always subscribe to our newsletter. You can go to our YouTube account to see a lot of extra videos. You can go to globalhealingcenter.com. You can type in the search bar anything that you want to learn. We're here to help educate. We're here to help walk you through. We have a whole staff, customer service, which will answer any questions that you possibly have. And I hope you have a great day today. Live healthy. And if you have any questions, get in contact with us. Thank you. Hey, thanks for watching. For more information on living a healthier lifestyle, check out more videos below. You can also subscribe to our channel and shop our supplements at globalhealingcenter.com.